Hello, everyone. Welcome back. Welcome back to the CAT Scan Group podcast. Hope you guys are having a amazing week. So, lots of things happening for the CAT Scan Guru as far as this brand. So, let me kind of give you the rundown as far as A through Z on what is going on in the land of the CAT Scan Guru podcast. So there is going to be a guest on the podcast. So working out the details on that. So when I drop that episode, you will know. Also, starting to ramp up some educational stuff on the YouTube channel. So as it's been highly requested, I am putting together a patient centering course that I will go ahead and it'll be available on the YouTube channel so that you guys can have that readily available to you. Also, doing a lot of protocol videos on my TikTok channel. So make sure you follow on TikTok. Make sure you subscribe to the podcast. Share with a technologist that needs to hear it and get some good advice, especially if they're brand new in CT. Also, if you haven't seen my videos or you haven't listened to the episodes lately, I have released a core CT protocols guide. It's in a bundle. So let me tell you what that bundle includes. So you get either a physical form of the guide or a digital form. So both of them are available for purchase, whichever is your preference. So there's an audio series that you get and then 2 courses. I'm in the process of making a third, but it's going to take time. So you get a contrast media course with the purchase of the guide, whether it's physical, digital, and you also get a course on the most common CT exams and protocols where I kind of break down each protocol where it's very easy. It's, good explanation as far as the common exams that we perform in CT. So it's a really good starting point, especially if you're new. So everything is in the show notes. There is a link to purchase either the physical form of the guide or the digital form. So both forms include the course bundle. So make sure you guys check that out. Also subscribe to the YouTube channel because a lot of educational stuff is coming out on the YouTube channel as well. And plus you can get the video portions of this podcast on the YouTube channel. So make sure you subscribe and share with friends. So in today's episode, I'm going to be talking about why new CT technologists plateau after their first year. Now, I have dedicated myself to making sure that the newer incoming technologists that are cross-training, maybe you're coming from a CT program or you're a traveler, you're brand new and you haven't been in CT very long, that you get the best information possible when it comes to protocols, navigating in CT workflow, things like that, because those things are very important. So a lot of techs do plateau after their first year. And in this episode, I'm going to dive into why. So why some CT technologists grow fast, they advance quicker, and some stall out after their first year. Well, I can tell you what the issue is, and there's going to be like a few pain points here, so stick with me. Typically, it's because techs get comfortable, they become complacent. I have seen some techs become lazy. So when you start to plateau after the first year, you start to get comfortable and you're thinking that things just don't apply anymore, which is further from the truth if you really think about it. So a lot of reasons why they plateau, or you as a new technologist plateau, is because you're feeling stuck and you're not sure why. You're watching other technologists just advance a lot faster than you, and you feel like you are just stuck and have nowhere to go. You're frustrated. You're losing your motivation early on. So this is a common phenomenon that I see. And there's several factors that really take place when it comes to things like this. There's a higher demand as far as exams when it comes to CT. The ordering is just overly excessive. Okay. The amount of patients and throughput that we're getting just increases every single time in every single year. And then technology keeps, advancing, which, yes, with AI and different advancement tools in CT, yes, it's very helpful, but patients are getting sicker. Patients are losing healthcare insurance. Patients are afraid to come to the doctor. And then by the time we see them in the emergency department, they're like on death's door. So there's a lot of factors that affect us because ever since COVID, our workflow has really changed the way the dynamics in CT and radiology departments, operate as a whole. So there's a lot of factors because we have such a high patient volume, high capacity, the high, over ordering. And yes, I am going to say that because that is the truth. So with those factors, you can lose motivation, you get frustrated, you feel stuck, and it's very easy to plateau after your first year. But I always say that it's not the end of the world because there is a solution to that. And a lot of things that I see as well is that after the first year, I've seen a lot of technologists just stop studying, stop educating themselves, stop learning, and they settle into this good enough phase. Like, what the hell is that? No, we want to get you out of that good enough phase because when it comes to CT, it's very complex. And when it comes to radiology as a whole, things are changing every single time, every single day, every single year, because something you may have done last year, it's completely different this year. Technology is advancing, so we have to stay on top of the education, the learning. That's why we do CE. But learning is not just only, satisfying your CE requirement. Learning is an ongoing thing. So you have to continue to educate yourself and never stop learning. So what is the answer to this problem? How can we make sure that if you are not as fast as your peers, what can we do to make sure that you don't plateau after the first year and decide, well, maybe this isn't for me and I want to quit? You know what we have to do? We have to adopt a simple strategy. So when it comes to structuring your training, especially in departments, you have to have something structured, something that is easy for them to follow, something that they can go ahead and say, yes, we're doing X, Y, and Z. And yes, I know how to set up an exam. I know how to set up my room. I know how to set up contrast. All the simple basics that every new CT technologist needs to know needs to be a solid structure and strategy. It's like the foundation of a house. Okay. You need to know the basics. The foundation of the house is everything because you can't have a party at your house if there's no foundation, there's no walls, there's no nothing, right? So here are a few things that I think every new technologist needs to know. And I say this in every episode, but I want to drill this into your brain because it's super important. Number one, have a notebook. You have to write things down. CT, you can't memorize everything. We're not basing our training off of memorization because that's not what we're doing, okay? You have to write things down because that's super important and that's how you remember things. Memorization, when you write things down, you tend to remember that more often and then you can refer back to it. And then the next thing is you really have to audit how your workflow is, how you set up your exams, how you're checking what exam they're ordering to what the clinical diagnosis is. Just simple things, verifying, allergies, verifying labs, audit your workflow on how you set up your exam from start to finish. Those are the simple things. I know we don't have time to look through everybody's chart. We don't have time to, read the notes and things like that, but just some simple things so that we don't create big sentinel events or big mistakes. To really audit your workflow really, really helps. And your throughput and making sure that you have all your checks and balances just dialed down. Also, get rid of unnecessary steps. Okay. There are some things in CT that are just fucking redundant and we don't need to do. Okay. So it's just the tedious tasks that you have to do. I know one of the tedious tasks that we got taken away from is, scanning paperwork into packs. I can't tell you that our radiologists are like, what the hell is this? What are we doing here? We have Epic that is like integrated into this. Now, I know some facilities, and I'm not knocking anything. Yes, your radiologists have you scanning paperwork still. And if that is your protocol, that's what you continue to do. But I know for us, it's a high capacity level 1 trauma hospital. We have to get things done quickly, and scanning a bunch of paperwork is not something that we have time for, and besides scanning consents that, we have to do, which now they're becoming more electronic, just the tedious paperwork because of an old system that we used to have before Epic came on board onto our hospital, we were doing all this paperwork and it was just an unnecessary step. It was an unnecessary task. It's something that it was a waste of time because nobody was actually looking at that paperwork. So any unnecessary steps that you can think of to make your workflow and just how you set up everything, and you go ahead and set up your patients, set up your exams, and get optimal images, get rid of. If it doesn't help you, get rid of it. The last thing is tracking your progress, seeing how you're learning. Everything is based off consistency and repetition and practice. It has nothing to do with how smart you are. Okay. Yes, you can be smart and still do all those things, but there are some people that are book smart and have no freaking clue what they're doing in that scan room. And I can vouch for several people in several facilities that I've worked at that, yes, you may be very book smart, but you had no fucking clue what you were doing in that scan room. And that's not the technologist you want. You want the technologist that knows what they're doing out there, not what they know out of a book. Yes, for the test, you need to know all the book smart stuff, right? However, when you're dealing with somebody's life in your hands and you are injecting medications, because contrast is a medication, you have to know what you're doing out there. Okay. So how this all just comes full circle is you get quicker execution, you get better clinical judgment, you make better clinical decisions as far as, is this test really necessary for the patient? Is this the correct test for the patient? Maybe I should talk to the radiologist about this. Maybe the ordering physician meant to order this instead of that. You get better judgment when it comes to that, especially when you go ahead and you do these simple steps. You also get respect from senior technologists. Okay. And I know at some places I've worked at, that was hard to do. Like I went through the grit and paid my dues. I grinded. I took all the shitty shifts, everything. And at some point, they're like, okay. So a lot of it has to do with respect from other technologists, especially the more experienced ones. And I always respect, techs that are new that just do the grit grind and just, put forward and learn and ask questions and really are just motivated to expand. And I respect techs like that. Professional growth just beyond being just a competent tech. A lot of people have, and I've seen this all over social media, a lot of people think that there is no growth when it comes to radiology. There is a lot of growth because I've seen a lot of technologists get PhDs. They go into public health. They become public speakers. They go into applications. They work for Stryker and these medical device companies. There is a lot of growth because when we have new devices and things like that we're implementing into our scans, a lot of them come from Stryker, and it's very helpful if they have a CT technologist or even a X-ray technologist that is part of that team so they can execute what, these ordering physicians want. So there is a lot of growth and possibilities when it comes to being in the radiology field. So if you want to move past survival mode, because CT, and I saw a TikTok on this once, like we are the rebels. Like we scan first and we ask questions later. And I will stand 10 toes down on that because that statement is very freaking true. So if you want to move past the survival mode and making sure that you don't plateau and actually really hone in on your CT skills and define them and make sure that you know your core exams and know your stuff, the core CT protocols guide bundle will help you with the basics. So make sure you check out the show notes for that because I go ahead and give you some simple courses to kind of dial in and everything you need to know, especially if you're brand new. Share with your friends. Somebody out there needs to hear this because you know what? I know there are the new CT technologist that is cross-training, and I know you feel lost. So this episode you need to listen to, even if you got to listen to it a few times. Okay. So make sure you check out the show notes for the Core CT Protocols Guide bundle. You can get it in two different ways, a physical or a digital version of the bundle. And also make sure you follow on TikTok at the CAT Scan Guru because I do a lot of educational stuff as far as on TikTok. And make sure you subscribe to the YouTube channel. Make sure you subscribe to the show so you can get the latest and greatest on podcast episodes. So thank you so much for joining me in this episode, and I will catch you in the next episode.